All right. Hi, Kensington family. I pray that you and your family are doing well through these challenging times. I just wanted to let you know that if you need help or prayer or someone to talk to, please give us a call at 248-786-0600. And we have folks that are manning the phones that are there to help you out. With the stay at home and stay safe and social distancing directives, things are looking a lot different than they did a couple of months ago. And yet I continue to be so encouraged and so amazed at how people are reaching out and using what's in their hand to love neighbors in such creative ways. That's really the heart behind our Move Out strategy, to see individuals and teams reaching out to be the church in their neighborhoods and in their communities. So right now, we know that one of the most critical needs is in supporting our first responders and our frontline workers. And so not only have we teamed up to provide meals to frontline workers, but we also have a team of folks throughout Kensington who are making masks to really help with the shortages that we're seeing. So right now I'm joined by Kappy Graney, who is helping to lead that charge. Kappy, thanks so much for joining me today. I wanted you to just begin by telling a little bit about yourself and then what led you to start making masks for frontline workers. How did you kind of get started with all of this?
Well, thanks for having me, Jill. So my heart really is toward healthcare workers, because not only are both of my daughters nurses, but my son-in-law is an emergency room physician as well. My mom was a nurse, and I worked in the healthcare system for about 8 years recently, and have a lot of connection with not just nurses and doctors, but other healthcare workers who have pretty critical jobs. So when this was coming down the pike, it was actually early March that we saw it coming. My daughter, who works at Troy Beaumont, was telling me that, oh my goodness, this is coming down the pike and we see it coming. We're afraid we're not going to have enough PPE, which is the personal protection equipment. And she sews as well with me. She's a partner with me in sewing. We decided to start making masks. I looked for a pattern for a CDC approved mask. At that time, the hospital was not accepting them, but they certainly are now. And the nurses and doctors and other healthcare workers actually are not only allowed to wear them, they're encouraged to wear them, and they wear them over the single N95 mask that they get, that they've got to hand to. But so Madison and I found the pattern. We started making them. She was still working at the time. The outbreak wasn't so bad. We were able to start to get masks into the hands of these healthcare workers. They were so grateful for them. They were so grateful, and that made us want to sew even more. We were being contacted by different workers from different hospitals. And we connected with Lori Nassif from Provide Inc. Lori got on board, and then as well started reaching out to other sewers. And so there's a small team of us that are doing this, and it has been an amazing, amazing thing to know that we are one little drop in the bucket, but we are able to help people out there when we feel so helpless right now ourselves.
Yes, absolutely. And I love how you saw the need and just kind of ran with it using what's in your hands. And one of the things that you mentioned to me earlier was that knowing that, you know, having worked in healthcare, having your daughters in healthcare right now, you guys are able to really get them directly into the hands of the people who need them most. You know where the needs are. And, you know, folks are feeling very loved and noticed and equipped. And it's something that, even though we're not on the front lines, you can like help stand in that gap and help support them. And I absolutely love that. So how many do you think you've made so far? And what do you think the impact has been so far?
Oh boy. So as a team, I think we passed the 1,000 mark for masks. Wow. We are now additionally making scrub caps for the nurses and the doctors, because the amount of COVID patients is so great, and you do need head protection, and that's limited as well. As a matter of fact, some of them are bringing in their own shower caps to wear. So we jumped into doing the scrub caps as well, but training up people in the process to say, hey, you can do this, you can make these masks. So that's great, because that's taking kind of some of the burden off of us and sharing this as a team. And the impact is not just in the Metro Detroit area. We have been able to send them to Philadelphia, San Diego, Boston, and Chicago, and I might be missing one more, from people who had reached out personally to say, please, can somebody help us? Is there anybody who can help us? So that impact has been felt all the way through there. And not just for the healthcare workers, but also for the people who are involved doing this and have said, well, maybe I can do something. And it's been great. It has been a real sense of camaraderie and teamwork, and people feeling like they can do something to have a positive change in all this going on.
Absolutely. And I love that. And so even additional impact is, as we were sharing about what you guys were doing on our Kensington website under how you can help, we've had about 40 other people kind of sign up and say, hey, can you send us the directions? Can we get involved as well? So there's some other sewers that are kind of on the outside of the teams that you're leading that are also doing the same thing. And they just want to be part of the solution. They want to try to help. So they're using what's in their hands as well, reading the guidelines, watching the videos, and asking questions, will you accept this mask or that mask or a headband or a cap? And we're like, yes, we'll take whatever you can offer, because, different folks have different needs. So as they're doing that, it's just examples of how people are really loving their neighbors and using what's in their hands. We also had a lady who said, I can't get out there to drop them off. And I was going to look into maybe picking them up for her, but she's in a senior apartment and now she's making them for everybody in her apartment. And I think that that's wonderful as well, because there's just, the needs are so great. But you were mentioning earlier that the needs are truly still with the frontline workers, with the healthcare workers. I love how you guys are kind of rising up to that and helping to support. What would you say to someone who isn't really sure how they can help or doesn't really sew? Is there a way that they can get involved in this? Or do you have any advice for somebody else who wants to get involved in a different way?
Oh my goodness, absolutely. Absolutely. So you guys are going to crack up at this. There are jobs you do not know how to use one of these things. You don't need to know how to do that, because guess what? There are so many steps and things to doing this that those of us who can sew, oh my goodness, you guys can free us up to have more time there. If you want to do things like be the handoff person to wash and iron the fabric that we're ordering it online, obviously can't go out to the stores. That takes us away from here. Cutting out the pattern pieces, which are super, super easy. We have some ladies that said, I got scissors, I can cut while I'm watching Netflix. Awesome, that's awesome. Teenage girls across the street from me hand wrote thank you notes that we're putting in the kits as well, showing their appreciation for these healthcare workers. My mom, who, don't tell her I told you, is 90, wants to do something, and guess what? She's ironing all the fabric because she's like, well, I can iron, I can do that. I have friends who have offered, hey, I'll be your pickup and drop off person. Yeah. I can't tell you what a huge part that is for us, because it frees those of us up who say, hey, there's some of us that can do this. It frees us up so that we can do that. So there are so many things. I had little nieces sorting buttons and they love doing that, and they were hand stitching them on headbands. So there are so many things you can do that you do not need to know how to sew. But here's what I do want to say. Some people are not feeling real confident about it, or they're thinking, well, that everything looks like they're going good, so I'm not even going to ask. And I would really encourage you, please ask people that you see that are doing serving, whether it's this project or another community type project in the midst of this. Because for the most part, we're not going around asking people. We're just hoping that you will jump in and partner. And if you don't know what to say, you can just say, hey, is there some way I can help you in serving? And I'm telling you what, we would, not just us, but anybody who's a part of serving would encourage that, welcome that. We love it. We need it.
Yeah.
We really do, because the need is so great out there. And as I said, our team is not huge. We feel like it's a drop in the bucket what we're doing. However, the more people that want to come alongside and say, I can't do that, but what can I do to
Mhm.
help you?
Yeah.
Uh, would just be awesome. And it feels great to be a part of doing something that's making a difference.
Yeah, yeah, and I love that, and that is such a great example. I mean, to just really, whatever God puts on your heart, whatever He uses and puts in your hand, to go ahead and use that. I know that with social distancing and with quarantines and so on, you feel like you're kind of isolated and kind of
Right.
locked it down. But there's just so many creative ways to still love our neighbors, to serve, and there's just things that still can be done. And I love how you've just rose to that challenge and rallied friends and family to help you. So for that, if anybody else who's listening to this, part of Kensington, wants to get involved, go ahead and go to our website, kensingtonchurch.org, click on how I can help, and you'll see all kinds of creative ways to get involved, including more information on being part of this mask team. And if you see the instructions for the masks and you're like, oh, I can't sew, email us anyways, and I'll get your information to Kappy, and she can help you be the cutter, be the ironer, be the sorter of buttons. But there's just lots of ways that people can get involved. So with that, I just pray that you're blessed. And Kappy, thank you again so much. You are such an inspiration. So thank you.
Thank you so much, Jill.